Radiation therapy is a treatment that uses high-energy radiation to damage cancer cells' DNA and to destroy their ability to grow and divide. The timeline on your screen is a detailed history of radiotherapy. From the timeline, it can be inferred that the radiotherapy was inspired by the development of X-ray in 1895. Henry Becquerel thought that uranium salt could emit penetrating X-ray-like radiation. Thus, in 1896, X-ray radiation was used to treat carcinoma. Moreover, X-ray radiation could not emit high-level radiation and reach the deep-seated tumors. Thus, it led to the development of Hubble-60, linear acceleration, and 3D conformal radiotherapy. Today, radiation therapy continues to grow and improve, and the new technology being developed is the image-guided radiation therapy.
Relevance. The biggest importance of radiotherapy is for cancer treatment. Despite radiation therapy's use of concentrated radiation beams, electron beams, gamma rays, and X-rays, it was recommended and the best cancer treatment as these beams and rays eliminate cancer cells. It also targets only the specific part of the body that is affected by cancer. Almost all types of cancers are treated by radiation therapy. It could even treat non-cancerous benign tumors. There are two types of radiation therapy, internal and external. With internal radiation therapy, the radioactive materials are implanted or inserted inside the body at the site of cancer. One or more implants is put into the body cavity or tissue using an applicator called a catheter, which is a metal or a plastic tube. Using the same applicator, other radioactive materials known as seeds and liquids slowly release radiation in the body over a few months. The radiation completely decays within 1 year. The most common example of this is brachytherapy discovered in 1896 by Henry Becquerel. On the other hand, external radiation therapy is the most common form of radiation therapy. It uses radiation from a machine outside the body that directs the radiation beams to the specific site of the body that has a tumor or cancer and destroys it. The most common example is the LINAC or linear accelerator, which was invented by Henry Kaplan in 1956 at Stanford University. We will focus on this kind of radiation therapy. To further explain the LINAC, it is a machine where the patient lies on a movable couch which helps the patient be in the proper position for a machine's high-energy X-rays, electrons, or beams to be directed to the specific region of the body properly and accurately to destroy the target tumor or cancer cells. There are 4 processes involved in LINAC: beam generation, dose measurement, beam quality monitoring, and LINAC control.
In radiotherapy, this LINAC is used for medicinal purposes since it produces beam in the form of X-ray and electrons that have high energy. Furthermore, in particle physics, a LINAC is suitable for electrons and protons to get high kinetic energy. The accelerator produces, monitors, confirms, and controls the radiation beam to the aimed target. For its processes, the first part is the beam generation. Magnetron produces radio frequency waves into the waveguide that accelerates the electron originated from the electron gun. The X-ray beam is created when the electrons hit and interact with a tungsten filament. The electrons exit the waveguide and enter the flight tube where the beam is redirected towards the target. Dose measurement. The photons now pass through the ion chamber for dose measuring and beam quality monitoring. The dose of radiation to be delivered to the patient is measured, and the beam is terminated when the required dose has been delivered. For the beam quality monitoring, the LINAC uses a multi-leaf collimator to ensure that the shape of the delivered X-ray beam matches with the shape of the tumor. For the LINAC control, one computer system controls both the LINAC and the multi-leaf collimator. This will eliminate symmetric errors and ensure synchronization between the delivered dose and the shaped beam. In biophysics, we can see that radiotherapy uses the concept of radioactivity in damaging unwanted cells. Radioactivity is the spontaneous emission of radiation in the form of particles or high-energy photons by an atomic nucleus. A nucleus that spontaneously destroys part of its mass to emit radiation is said to decay, which is a term used to describe the emission of radiation by atoms in excited states. A substance or object that emits nuclear radiation is said to be radioactive. In radiation therapy, nuclear radiation is used and focused on harmful tissue, such as cancerous tumor, to selectively kill or shrink the tissue. Radiation used for cancer treatment is called ionizing radiation, for instance, the X-rays and gamma rays, because it forms ions, which are electrically charged particles, in the cells of the tissues it passes through. It creates ions by removing the electrons from atoms and molecules.
Although there are more advancements in the studies of physics and radiotherapy, there is still plenty of room left for improvement, especially in its biomedical applications. For example, the four-dimensional motion management and particle therapy, as well as the efficiency of more compact and cheaper technologies. Bigger challenges lie ahead for physicists in radiotherapy beyond those localization problems. For example, in the areas of biological target definition, improved modeling for normal tissues and tumors, advanced multi-criteria and robust optimization, and continuous incorporation of advanced technologies such as molecular imaging.